Hello, and welcome back to this scientific ethics lecture where we're going to take a look at stem cell therapy. And so basically move on from where we were at the last class where we talked about what stem cells were and basically what embryonic stem cells are and how we could create some embryonic stem cell lines, but move closer and closer to how we can use these stem cells as a potential treatment or as a potential therapy for individuals that have kind of dead or dying cells or dead or dying organs within their body. And so a method of kind of treating what's wrong with them in the absence of having tissues or organ donors under normal circumstances being available. So what we're talking about is a concept called regenerative medicine. And regenerative medicine, like regeneration, is this idea that we're going to be replacing or repairing human cells, tissues, or organs in an effort to restore their normal function. And so again, to put this into kind of a classical setting, we've got the Greek Titan over here, Prometheus. He's chained to a rock, and as part of his punishment from Zeus in the battle between the gods and the Titans in Greek mythology, Zeus sent an eagle to eat Prometheus's liver each day. So Prometheus is a Titan, kind of the previous rulers before the Greek gods came out, became established. He's basically there, can't defend himself. The eagle comes, eats his liver. That's bad. You need your liver to survive. But Prometheus, like most individuals, has a liver that under the right circumstances, their cells can continue to divide. And so Prometheus's liver regenerated daily, enabling him to survive. So for some individuals, it's capable, their liver is capable of dividing and replacing the cells if they have like a little bit of damage or potentially if they're involved with a liver donation. The problem is if you've got a diseased liver like cirrhosis of the liver, or you've got hepatitis of the liver, those cells aren't going to be able to repair themselves, and so you can't restore the function in this way. So we need to come up with some way in which you can replace the body organs that have been dead, damaged, repair them to restore the normal function. Now, this is a case where we're taking a look at the research on this. Again, we can't do research on human beings with many experimental settings, and stem cell sciences at its infancy in our understanding and its application. So in many cases, these studies are done in animals. And it's done in such a way that they've got good evidence, they've got good findings, good understanding about what's going on, at least in the animals. And so because of that, what we can see, even in the United States, is that some veterinary practices are using stem cell therapy to treat animals. And so the best example of this is vet stem regenerative medicine. This is an idea that you could basically use some fat cells from the adult animal. So you would primarily doing dogs at this point. You can isolate some of these fat cells and find these adult stem cells that are present within it. And they can take these adult stem cells, grow them in a laboratory setting, and under the proper circumstances, they can then be pushed into one of these directions. In most cases, when we're taking a look at it, they're going to be used to produce tendons and ligaments. They're going to be used to treat osteoarthritis. So they're often injected into joints to treat what are osteochondral defects, but basically the cartilage that's at the end of the bones. And so if you take a look at patients with arthritis, they've got bone grading on bone as opposed to having the cartilage at the end of the bone forming this nice smooth connection between them that kind of cushions the impact as you're moving around. And so anybody that's had arthritis knows the feeling of bone on bone is very painful, and it would give just about anything to have that repaired. We're able to do that in dogs and in some animals by taking their own cells, pushing them into a specialized cells that can form cartilage, that can heal the joints in some way. And so again, we said that stem cell medicine, regenerative medicine is in its infancy, but we're seeing it being done within animals. And so to look at this at a greater example, when veterinarians do this process, you collect fat cells from a dog, a cat, or a horse. You process it within a laboratory setting, isolate the stem cells, concentrate the stem cells, and then you inject the stem cells back into the affected area, back into the area where they may have an arthritic joint. And what they're able to see in a study, quality of life surveys, basically ask, we can't ask the patient in this case, we can't, go up to a horse and say, how do you feel? But their owners were able to say that in about 80% of the cases, they felt the animal improved. In about 12% of the cases, they felt that there was no change, no benefit, but no damage through the process. And only about 7%, so less than 10%, said the condition worsened. And so with this result, and this was done in a double-blind, placebo-controlled study, and so it eliminates that placebo bias that we've talked about previously with medications. We're looking at it and saying, okay, did the patient, in this case the animal, improve without knowing whether or not they got stem cells or just random injections? And in this case, pretty good evidence that those that received the stem cells had a pretty good recovery. And so then what we got then is this huge potential. It works in animals, then potentially it should be able to work in humans. And again, keep in mind here that what we've been able to do is isolate cells from the animal's own fat. So we don't have to worry about rejection of the tissues, rejection of the cells, because it's the body's own cells. We're just taking them out, isolating them, and injecting them back in. Okay, so if we take a look at this, and again, the state of stem cell transplantation, stem cell science within medicine, what we've got is that the majority of stem cell transplants are associated with bone marrow stem cells. And so we've been doing this for a number of years without talking about it as stem cell therapy. And so what happens is, you've got either a patient where we take the stem cells from, or in many cases a donor, where we're going to take these adult stem cells from the bone marrow, grow them up in some way, and then inject them back into a patient. And we're using this to treat cancers like leukemia, lymphomas, things like that. So you're basically taking the diseased stem cells in this patient, killing them with radiation, killing them with chemicals, and then repopulating kind of the stem cells within their bones from the donor. And in doing so, excuse me, sorry about that. And in doing so, kind of reestablish that stem cell population within the patient, ideally producing lots and lots of blood cells that allow this patient to be healthy kind of going forward. So again, trying to improve this process, bone marrow transplants are incredibly painful. So there's a thought that we might be able to isolate these stem cells from the peripheral blood. And so for somebody that's done apheresis, that's done platelet donations, you've got an idea how this works. You've got a donor in a clinical setting hooked up to a machine that's going to be taking blood out, and it's going to be taking blood in, running it through a process. In many cases, it's going to be a centrifuge that spins it and separates the cells based on their density. And in this process, they're going to return the rest of the blood cells back to the patient here, where the stem cells then are going to be collected and isolated. If you're donating platelets, it's doing the same basic thing, but what's going to happen is going to take the blood out, you're going to centrifuge it, treat it, you're going to isolate the platelets and return the platelet-less blood to the donor. Again, the idea is that this is a less invasive process that allows us to get at those stem cells that we need. Another way of getting to the stem cells is cord blood or umbilical cord. And so if you've known anybody that's had a newborn baby in the last 15 or 20 years, there's an option to do cord banking. There's an option that part of the umbilical cord is going to be collected, and within the umbilical cord are going to be some of these primitive stem cells. And the idea being that if we isolate those cells from the umbilical cord, we can use them for this infant when they grow up as a replacement set of cells. And so we can take the umbilical cord, isolate the cells, and freeze it. and the potential that it could be used to treat this baby as it grows up later on. And so again, relatively recent advance, but it has a great amount of potential going forward. Now, about 10 years ago, in November 2011, the FDA-approved HEMACORD. HEMACORD is an example of hematopoietic progenitor cells. Really complicated way of saying that we're able to take some of these progenitor cells from the umbilical cord and use this as an alternative to bone marrow transplants. And so we basically take this umbilical cord progenitor cells, grow it up, and use these cells as a replacement for the blood producing cells within the body. Now, again, this still has to have a match, because in this case, we're not talking about taking it from the individual and putting it back into the same individual. And so we're worried about having a good match, but it is, again, potentially an unlimited supply of these stem cells that are needed for the treatment of the diseases going forward. If we take a look at the state of stem cell therapy within the United States, it is possible to get stem cell transplants within the United States, but it's very, very limited. The clinics or the doctors that are doing it have to follow good tissue practices, and it's basically viewed as a blood or human tissue transplantation. But the current rules are we can do stem cell therapy, or at least the doctors can do stem cell therapy, if the cells are collected from the patient, and so they're going to be basically collected like the equivalent of from the fat cells from the vet system that we're taking, veterinary system that we're taking a look at before. You can take those cells out and infuse them back into the patient on the same day with minimal manipulation. And so you can take them out, you maybe purify them a little bit, but you can't alter their genetics, you can't alter them, treat them with chemicals or mix them with other things. You basically have to take them out of one region of the body, kind of purify them and inject them into another region of the body, which is basically going back to what we saw back here, what we're talking about here. So collecting the fat from the daughter cells, concentrating the stem cells, and injecting it back into the infected region. And so in the United States, we can basically do that, assuming that there's minimal manipulation. And again, in the government's infinite wisdom, they haven't defined what minimum manipulation is, but basically what you can do within the same day without putting a whole lot of things into it. Now, putting this into a little perspective, this is getting a little bit dated now, but it's one of the most famous examples of this that I know of. The football player Peyton Manning, he was a quarterback for the Indianapolis Colts for a number of years, and then went to Denver, Colorado, and played for the Broncos. He was having a lot of neck pain, a lot of problems with degeneration, with bulging discs within his neck. And what he did is he went to Europe. It's an example of medical tourism. He had mesenchymal stem cells, so basically isolated some of the fat cells from his body, prepared them in some way, and then injected them into the neck. And in doing so, they were able to regenerate the damaged tissues. And in this way, he was able to kind of repair what was giving him pain, be able to treat it. He had to go to Europe to do it because it wasn't allowed in the United States at that time. But he was able to come back. He was able to continue to play football for a number of years. And he was a Super Bowl winning quarterback after having this procedure done. So again, lots of potential in this process if we can understand what's going on and if we'd be able to study it and deal with some of these ethical conundrums that are associated with all of this technology. Another example of this, we're getting closer and closer to that 3D printer that I tossed out there and said it was science fiction before. But we're looking at this idea that we can create these human organs kind of grown in a laboratory setting, and then use this as an organ, not from a donor, but from a clinical setting. So in this case, we had a donor trachea. We're using this as a skeleton. but it's basically forming the scaffold or skeleton in which we're going to allow cells to grow into. Stem cells from the patient's own bone marrow will grow out, populate the skeleton, and basically, in this case, produce the organ. In this case, what we're looking at is a trachea. Now, previously, we're kind of doing this within the laboratory within a donor structure as a skeleton. So you take it, kind of leave the cartilage behind, but yet kind of remove all the other cells that might have an immune response or might be, in that graft versus host reaction that we're worried about. But more recently, they've been able to do this with synthetic trachea. And so they basically kind of recycle soda bottles, create this three-dimensional kind of trachea shape, these rings of cartilage that are going to be present here, grow it in a laboratory setting with the patient's own cells, and it will be populated with the right types of cells that are there. And you can do a trachea transplant. It's not currently approved within the United States, but we had a US patient, again, medical tourism going on, going to Sweden for this about 10 years ago. And so again, closer and closer to the stem cell technology, but lots of things we needed to worry about. One thing that we need to worry about is that stem cell therapies are said to treat a wide range of diseases, and it has the potential to treat a wide range of diseases. But we don't understand it well enough at this point. And there's this kind of mindset that if something is too good to be true, there may be some problems with it. If it treats everything, if this is something that is a treatment for every disease known to man, it's probably not going to be effective for doing everything. Stem cells are going to be a great replacement for dead or damaged cells, but we got to replace the right cells. We got to replace the right cells with the right type of cells, the right level of development, put them in a process that can become integrated within the body. So there's still lots of problems. It's not quite snake oil liniment now, but it's being purported to be this as we look at a lot of advertisements for medical treatments. There's also concerns that without controlled clinical trials, it's impossible to determine if the stem cells are effective. Remember that placebo effect that we talked about when we were doing drug development. There's potentially a placebo effect in transplanting in these stem cells, and there could be effect of just transplanting in any cell or just doing the surgery. It could be generating some type of effect, and so we're worried about placebo effect. We're also unclear and worried about long-term outcomes. We're taking cells, we're growing them in a tissue culture setting, in a petri dish or a test tube, and then implanting them in the body with the hopes that they're going to grow out, populate the regions they want, produce the types of cells that we need, and then stop doing what we want them to do. Stop dividing, stop growing, stop becoming specialized. And there are reports that in some cases, these cells don't stop. They continue to divide, and in some cases, produce benign tumors. Benign tumors are kind of like a growth, not cancers because they're not malignant, they're not spreading through the body, but they have the potential to form a tumorous growth if they continue to divide instead of being kind of under control under normal circumstances. So lots of potential, but still a lot we need to learn about it. According to the clinicaltrials.gov site, so again, we talked about this very briefly when we're talking about drug development. If we take a look at what's going on with stem cell technology, we've got about 2,500 phase 1 clinical trials. And again, phase 1 clinical trials are where we're doing it with a small population of healthy individuals to make sure that it's not harmful. About 3,500 phase 2 trials. Phase 2 trials, again, are testing its safety, but beginning to test it on patients to see if it might have an effect. Fewer 760 phase 3 trials. These are where it looks like we have some type of effect at treating the condition, and now we're doing it much broader to treat more patients to start to pick up on potential problems, potential adverse effects, potential side effects that are associated with it. And then we've got about 202 phase 4 trials, and phase 4 trials are basically after marketing, and so they're after stem cell therapy has been approved, but we're still looking at it again to try to understand some of those long-term effects that we don't know, because this is really, really new technology. Now, the only FDA-approved products derived from stem cells right now are blood-forming cells. So like we've talked about before, we're taking the cells and reestablishing the blood-forming cells within the body. Often used with limited use with disorders with patients in the production of blood cells. And so basically what we're looking at is a replacement for bone marrow transplants. Bone marrow is similar. It's got the stem cells within it, but they're not isolated. And because they're not isolated, it's not viewed as kind of a true stem cell therapy, even though that's what has the effect. But in general, it's not regulated. Bone marrow regulation or bone marrow transplants are regulated by the FDA for use in stem cells. They're recognized as a treatment for kind of like organ transplant. So that finishes up our overview of stem cell therapies. So hopefully you get a flavor for lots of excitement, lots of potential in this, but also lots that we need to understand. And we need to learn, you know, scientifically, you know, what are the limitations of what we're doing this, and ethically, you know, is this something that we should be doing? For the readings with this, again, a little bit older article, but it's a good article talking about kind of the greater framework and theory behind regenerative medicine. It's where I got the Prometheus image from the first part of this lecture. This again is from the Department of Health and Human Services, from its US government organization within kind of the broader reaches, but it's focused on what the NIH is doing. It's actually an NIH site that has that. And then a more recent article from 2019 warning about stem cell therapies. It's not the snake oil salesman saying you can treat all things equally well. You know, there's some limitation, there's still some risks about it because we don't understand those limitations. So take a look at that. Come back so I can talk to you about the kind of assignment for today's lecture. As always, if you have any questions, feel free to email me. Thank you and have a great day.